Okay, today's chapter is going to be chapter 46, EMS response to terrorism involved weapons of mass destruction also. Um, now, I haven't been able to upload the video from Monday, but I'll do it after class today. And that consisted of chapter 45, 44, and 43. The rest, you guys should have the links to the videos and the Zoom videos that on YouTube. So let's go ahead and start with this one. This should be our last chapter. I know I said that we might have the test on Friday. I do want to see if I can change it to maybe Monday so I can have a review session on Friday on questions so you guys could be better prepared for the exam. So let's go ahead and get started with this. Okay, weapons of mass destruction are possibly are a possibility EMTs must be prepared to respond to. Now, and all this, I don't want to say it got started with 9/11, because I know that since before 9/11, we've been talking about being careful on where to leave the ambulances or whatever, because they can actually be used as weapons of mass destruction. So. Okay, the weapons of mass destruction are intended to cause widespread death and destruction. The mnemonic Seaburn and Be Nice can actually be used to remember types of weapon of mass destruction. We'll go over those. Seaburn basically is the type of weapons that you can have are chemical, biological, radiological, nuclear, and explosive. Okay. And Be Nice is biological, nuclear, radiological, incendiary, chemical, and explosive. Incendiary basically meaning turning on fire. Okay. Dissemination means bringing the weapons of mass destruction agent into contact with its intended target population. I know that, some of the training that I've gotten in the past is scenarios like, well, there's a mass shooting, there's a threat of mass shooting inside a building, and you need to be very careful because when you try to exit, the building, they're waiting for you to shoot you. So things like that, the general approach to weapons of mass destruction incident is the same as the other disasters with multiple casualties. Total World Trade Center attack on September 11, 2001 required a massive coordinating effort for rescue and recovery operations. And this is the 9/11 incident that happened. Supplies and equipment to ensure adequate equipment and response. There must be a community response to the disasters. Yeah, I'm having problems with the internet again. Each type of weapons of mass destruction requires different specialty, equipment, and supplies. A plan must allow immediate deployment of individuals, equipment, and supplies. Coordinated community medical response to the World Trade Center attack. Remember that a lot of people went to the World. Before that, we had the Oklahoma building explosion, which was a federal building. And in between that, we had a couple of explosions in New York, train stations, subway stations, where I remember that even there was one in China that they had a chemical that was released within the tunnel system of what do you call it, the subway system out there. I can't remember what the chemical was, but it was a neurological agent that affected a lot of people. Okay, there must medical direction. There must be a plan to establish medical direction and verify credentials of responders from outside areas. And I know that I've been involved with some of the practice deals that they have with the airport here. Well, I used to be involved where they have the, what do you call it? They used to have the airport disaster situations. And I remember one of the last ones that I went to, and it didn't dawn on me. I mean, we had planned to actually bring all these ambulances to the airport area whatsoever. Um, and we had students and everything, getting ready for the disaster. And one of the things that they caught the airport security, it was they were just letting in ambulances without checking the validity of the ambulance or anything like that. So there was people walking in and out with and going in and out with ambulances, and any one of those ambulances could have had, disastrous what do you call it, implications to the public that was there. Communications may actually be unreliable, requiring reliance on standing orders. So whenever you have something like this, uh, when you have 40, 50 ambulance companies trying to get in touch with a medical director, it's not going to happen. And the radio communications are going to be almost nil because you're taking up the airwaves. So standing orders, like your protocols, are going to have to suffice with that. As always, EMS providers, safety is the highest priority. You must be aware of the indications of the weapons used and the potential for secondary effects of the attack and secondary attacks. Uh, Responding to the scene, the earlier weapon mass destruction incident is recognized, the better. The incident command system is used with weapons of mass destruction attack. Hazardous materials principles are used if the agent is a chemical itself. Again, you calling the right people to the right situation. Signs of toxic and unsafe environment include respiratory distress, dyspnea, cough, burning chest, and burning eyes. That means that there's something in the air that's affecting you. So now, issues of scene safety: wear a HEPA and or N95 mask, gloves, eye protection, and gowns for suspected communicable illnesses. Approach from upwind. Avoid confined spaces. Uh, Entry must be made only by those with specialized training and protection and alert direction prior prior to transport. You need to let them know where you picked up a patient with this and where you're going to be taking them to, unless they give you the order, as they should, if it's a mass casualty incident. The role of the EMT at the terrorist incident involving weapons of mass destruction, initial incident command, and scene size up, sector leader of officers such as triage, treatment, and transportation, and providing care and transportation. Recognize locations or events that may be terrorist targets, and use caution when responding to those locations. The death from terrorist incidents are now considered evidence, and be aware that perpetrators may actually be among the injured itself also. Conventional explosives and incendiary devices are the most widely used weapons of mass destructions. Explosives, you have ignitions of fuel that burn rapidly, causing hot gases to actually displace air, creating a shock wave. A blast moves in all directions at supersonic speeds, causing a blast injuries. And remember, blast injuries usually affect your hollow organs, so be very careful of that. Improvised explosive devices. You have improvised from easily obtainable products. Remember the Boston Marathon situation that we had? These guys were carrying a big backpack with what was it? Like a kettle type of thing, like where you have make soup, and it was lined up with explosive and a lot of pellets and nails and everything. So Vehicle-borne improvised also explosive devices, where you have cars that are being used, or trucks that are being used as bomb. Commonly used an explosive called ANFO, which is ammonium nitrate and fuel oil, which basically the ammonium nitrate is like a fertilizer type of chemical, and they keep track on the type of people that are buying them, and they're but sometimes they don't work fast enough. I know in the Oklahoma explosion, they actually used this ammonium nitrate in fuel oil inside one of those what was it it wasn't a U-Haul, but it was one of those trucks that are like U-Haul based. Common explosive compounds: EGDN, HMTD, PETN, RDX, Semtex, and TAPT. And all these are explosive devices. Compounds that are used to make these explosions. Primary, secondary, tertiary, quaternary, and quinary effects. The explosion blast is the primary effect. A secondary effect results from flying debris or shrapnel. Tertiary effects are injuries produced by the propulsion of the person's body. And quaternary effects include burn, crush, and inhalation injuries. And the types of injuries: the lungs, blast lung, and pneumothorax may occur. Remember, lungs are actually hollow organs. Look for altered mental status, dyspnea, bloody sputum, chest pain, and stroke-like signs and symptoms. Use caution with positive pressure ventilation to avoid creating air emboli and tension pneumothorax. In the abdomen, you have bowel may actually be bleeding or leak contents into the abdomen itself. In other words, there's hollow organs again, the small and large intestine, and you might actually have evisceration possible, where part of the intestines are actually sticking out. In the ears, the eardrums may actually rupture, and the inner ear bones may actually be disrupted. There may be some hearing loss, and I know that in most cases, because I've actually seen it in movies now when there's a big humongous explosion. The next thing you see in the movie is like they're hearing that high pitched sound like ding. I know that with me it happened when I was a kid. Uh, I was trying to turn on the fireplace, and being a kid, I got a can of what do you call it? Lighter fluid, like to turn on barbecues. And we had logs in the chimney because we didn't know how to deal with the heater and the air conditioner at that time. We were looking for a heater. So I turned it on, and the tip of the can caught on fire. And me and my sister were fighting over it. The next thing I know, I was trying to like turn it off, and it just that can just like popped. And I remember the next thing I hear is that ding. Of course, the can was empty already. You had already poured everything into the wood to make a fire. Like I knew how to turn on fire. And the thing is that we had one of those instant light up logs, which didn't need that. Okay, crush injuries. They may occur from a structural collapse and entrapment. Complications occur when the pressure on the crust area is relieved. In other words, you have um, the formation of lactic acid um, in that part because you're not getting any blood supply to that area. So lactic acid, that part of the body starts going through anaerobic metabolism and producing lactic acid. Now, when you actually release the pressure, all that lactic acid flows back into the bloodstream, and you have secondary effects on that. Yes, shrapnel also penetrating injuries can actually cause bleeding, hollow organ penetration, and fractures. Incendiary devices. Be cautious of secondary and undetonated devices. The primary cause is usually burns. Assess burns according to the rule of nines. We need to go over a couple of videos before we finish up the course on the rule of nines because a lot of people have problems with it. Pay attention to airway and breathing and address any burned areas. Properties of chemical weapons can actually be dispersed using munitions or aerosol devices. Primary causes burns. It says burns according to the rule of nines. Pay attention to airway and breathing and dress. And why I went over that one. Can actually be dispersed during munitions of aerosol devices. Like tendency of agents to evaporate and create vapors is its volatility. I'm sorry, couldn't even pronounce that word. Agents that do not evaporate are characterized as persistent, and evaporation is affected by temperature also. Some chemicals, agents, you have nerve agents, vesicants, cyanide, pulmonary agents, riot control agents, and toxic industrial chemicals. And the riot control agents, as you have this pepper spray and all this other stuff. Potential for easily made, potent and easily made, block the enzymes that attack, that break down the neurotransmitter acetylcholine, allowing accumulation of acetylcholine, causing a spasm in the muscle. And imagine if that one is in your respiratory, muscles, you're not going to be able to breathe. Overstimulation of muscles, smooth muscles, glands, and nerves as a result. Sarin is the chemical that I was trying to remember that happened in one of Japan or China, one of those Asian countries, where they released sarin into a subway station, and a lot of people got sarin poisoning. So, man, GF, methyl phosphonatoic acid and Novichok agents, which is usually a Russian nerve agent. When it comes to vapors, small exposures, you have runny nose, mild dyspnea, pupillary constriction. You have a sudden onset of unresponsiveness, seizures, apnea, copious secretions, and pupillary constriction. With liquids, you have small exposure. You have localized sweating, nausea, vomiting, fatigue. And in large exposure, you have sudden onset of unresponsiveness, seizures, apnea, paralysis, and copious secretions. Now, nerve agents, signs and symptoms, respiratory failure, and paralysis of respiratory muscles. You have copious airway secretions and bronchial constriction. And we use the word sludge, which basically sludge means salivation, lacrimation, urination, defecation, gastric distress, and emesis, which basically we used to actually diagnose nerve agents. And usually, like, this is the sludge, we use it a lot when it comes to organophosphate poisonings. And organophosphates are usually chemicals that we use to actually kill bugs uh, in our grass or our plants or whatsoever. So it's a nerve agent. Emergency medical care, ensure adequate airway and ventilation, be prepared to actually suction. The medication atropine and fraxamine are antidotes to this. Combat seizures, benzodiazepine, diazepam, and words lorazepam, and midazolam should be used when it comes to when you have a patient that's having seizures. All these are muscle relaxants. Vesicants causes blistering, burning, and tissue damage. Agents include sulfur and nitrogen mustards, leucite, and phosphine gas or phosphine oxide. Signs and symptoms: runny nose, runny retinas, blistering and necrosis, stinging, tearing, and developed of ulcers in the eyes, shortness of breath, coughing, wheezing, and pulmonary edema, nausea and vomiting, and fatigue. Emergency medical care, you irrigate, as with any other type of chemical agent that should, that you have in your body. A lot of times you just sweep it off and then you irrigate. Manage chemical burns, apply a dry sterile dressing. Lucite and arsenic-based agents has an antidote called uh, uh, dimercaprol. I remember that one. Cyanide rapidly disrupts the ability of cells to use oxygen, may be inhaled or ingested. Death may occur within 6 to 8 minutes with high doses. And cyanide, I know that back in my time when I was a kid, there was uh, an issue when they had a whole bunch of people at this place. It was it's a southern. I mean, I want to say southern. It was a South American country. I want to say it was Guyana or sort of, but I mean, I remember that they forced all these people to kill themselves by drinking Kool-Aid that was laced with cyanide. Then, of course, we had something that was more recently back in the 90s where a whole bunch of people were waiting for, or maybe in the 80s, I don't know, waiting for the comet to send over a spaceship and pick them up. But the only way they were going to be picked up is by releasing their energy from their body. So they committed suicide. Signs and symptoms: anxiety, weakness and dizziness, nausea, muscle trembling, tachycardia and tachypnea or apnea, seizures and unresponsiveness, pale, cyanotic, and normal skin color, normal color of the skin. Emergency treatment: manage the airway, breathing, and oxygenation. There are antidotes available: nitrites and sodium thiosulfate and hydroxyl cobalamin also is used. Pulmonary agents include phosgene, other halogen compounds, and nitrogen oxygen compounds, act primarily to cause injury or lung injury. Signs and symptoms: tearing of the runny nose, throat irritation, dyspnea, wheezing, cough, crackle, stridor, and secretions. Emergency medical treatment: manage the airway and breathing, be prepared to suction and administer oxygen. Now, this is only when you get out of the hot zone, guys. While you're in the hot zone, you need to remove the patient and yourself from that hot zone. Riot controlled agents like tear gas and pepper spray causes extreme irritation to the eyes, nose, and mouth, skin, and respiratory tract. Emergency medical care is supportive and may actually include irrigation of the eyes themselves. Toxic industrial chemicals, they may be obtained from hijacking, rail, or truck transportation of chemicals and sabotage of chemical plants. The approach and treatment depends on the agent involved. It just depends on what we're dealing with. Biological agents, they actually consist of living organisms or their toxins. Small amounts can actually cause widespread illness and may actually take days to detect because we have what we call a period of incubation on these some of these chemical agents. I mean, biological agents. Dispersed methods vary. The respiratory tract is the most common portal of entry, like we had recently a few years ago with COVID. Now, I can't say it was used as a weapon, but come on, guys. Uh, Specific biological agents, group of biological agents include pneumonia-like agents, encephalitis-like agents, the ones that affect your brain or your meninges and everything else, biological toxins, and other agents. Um, Now, pneumonia-like agents you have present with fever, difficulty breathing, and include anthrax, the plague, tularemia. Encephalitis agents include like smallpox, Venezuelan equine, encephalitis. Of course, there's a whole bunch of newer ones out. Uh, Biological agents, you have botulinum, uh, which basically is this. You have descending paralysis, and as opposed to any type of paralysis in your body, you have to distinguish between descending and ascending. So basically, descending basically goes from the core of the body outward. Okay, and that should be like botulism. But when you have the other effect, when you have ascending uh, paralysis, like it starts from the tips of your hands and it goes backwards to your system, that's like Guillain-Barré right there. And that, I've seen a couple of cases of Guillain-Barré. You have double vision, blurred vision, dry mouth and throat, difficulty speaking and swallowing, and dyspnea and respiratory failure. Ricin, which is you have weakness, fever, cough, hypothermia, and death. You have Staphylococcus enterotoxin 13, which you have fevers, chills, headache, body aches, and non-productive cough. Epsilon toxin, you have cough, wheezing, and shortness of breath, respiratory failure, and death. Trichothezene myotoxins, you have pain, itching, and lesions, runny nose and sneezing, sloughing skin, dyspnea, wheezing, chest pain, and hemoptysis. Remember what hemoptysis is? Coughing up blood. Cholera, you have vomiting, abdominal distension, and profuse diarrhea. You have severe dehydration and little or no fever. Uh, with viral hemorrhagic fevers, you have malaise, body aches, headache, vomiting, flushing, and petechia. Now, petechia is when you have the little red dots forming on your skin because all these blood vessels are rupturing. Easily bleeding, hypotension, and shock. And I think we had a few years ago. We also had some cases of Ebola that occurred here in the U.S. And I remember the Dallas area was one of them, where they had one guy that actually had was infected by the Ebola virus, and they completely had to like um, take care of the building. And I remember one of the nurses didn't gown their equipment right or whatever, because of the type of patient that they had, and she also got infected. Cholera, you have vomiting, abdominal distension, and profuse diarrhea, severe dehydration, and little or no fever. Uh, with hemorrhagic fevers, you have malaise, body aches, headache, vomiting, flushing of and petechia, and easily bleeding, hypotension, and shock. I think we went over that one already. Did I go back? Brucellosis, which occurred after 9/11. I think, or it was at anthrax, one of those two. But I remember brucellosis is an agent, a biological agent that's actually found in the dirt, especially where you have cows or like goats, and they actually and you have you catch brucellosis, believe it or not, by eating cheese, certain types of cheese that are infected. So you have fever, malaise, body aches, joint pain, headache, and cough. And I dealt with a couple of patients of mine that developed brucellosis in Mexico, but it's like a common thing over there because a lot of people live out on the ranch. Specific biological agents, you have emergency medical care for biological agents, you have pre-hospital care, it's supportive. Recognizing and contacting public health officials is crucial. Smallpox, the plague, and Ebola are highly contagious. Use appropriate personal protective equipment just in case. Well, you should be using it no matter what. Okay, and you find out that once you start seeing the pustules that the smallpox produces, or the plague, or the the bleeding of every orifice in Ebola, you're going to be glad that you were wearing uh, uh, your PPE. Emergency medical care for biological agents. You have hospital care includes antibiotics and antitoxins, immunizations, and prophylactic treatment are used in some cases. Okay. You have three types of mechanisms of death when it comes to nuclear weapons and radiation. Radiation, the blast itself, and thermal burns. Radiation energy is released from radioactive atoms, passes through and changes the structure of molecules in your cells of the human body itself and produces a lot of type of cancers. The cells may actually die, repair, and reproduce mutated cells, which is a cancer cell. X-ray gamma radiation is the most penetrating type of and can actually travel long distances. You have neutron radiation is powerful, damaging particles associated with nuclear reactors and nuclear bombs. Beta radiation is low speed, low energy particle that actually is easily stopped by 6 to 10 feet of air, clothing, or first few millimeters of skin, but poses a serious hazards if ingested. Alpha radiation is heavy, slow moving, and easily stopped, but poses a serious threat if inhaled or ingested. Exposure associated with nuclear explosions. You have primary exposure, which is radiation including the that occurs during or shortly after the detonation itself. And the fallout is radioactive dust and particles that can actually be life-threatening to people far from the epicenter of the detonation. They won't die right away, but eventually they will die of cancer. Nuclear detonation causes rapid heating of air and actually explosive expanding gas cloud. Injuries are the same as those from conventional explosives. The wind blast can actually reach 160 miles per hour itself, which is that blast that from the initial explosion. Thermal burns usually cause most death and injuries from nuclear explosion. Heating is a short duration, but very intense. The eyes can actually be damaged from the intense light. Uh, and I know I mentioned the dirty bombs before, which is a conventional explosive attached to radioactive material. It's a bomb that's surrounded by radioactive material. So when it explodes, it sends that radioactive material. It's not a nuclear bomb. It could just be a pipe bomb with nuclear. I mean, you can easily get these nuclear materials from hospitals. Okay, risk of widespread radiation illness and contamination of the environment. You have a radiological exposure device. Does not use an explosive itself. Improvised nuclear devices assembled and built specifically for terrorist incident. You have low quality materials and may not detonate properly. Assessment, most destruction of death is nearest the center of the blast itself. There is less death and injury further from the blast. It identifies the time after exposure and the agent, and the patient complains of any radiation-related signs and symptoms. And some of these signs and symptoms include nausea, fatigue, malaise, and clotting disorders, vomiting, no appetite, diarrhea, and hair loss. reddening of the skin, rapid onset of incapacitation, cardiovascular collapse. Oh, what happened? What was that actually? I don't know why I jumped. Oh, where the hell? Okay. Assessment of low quality material. And there you go. There is less death and further from the blast. Identity at the time of exposure to patients to complaints of radiation related sensitivities. Here we go. Retina is getting rapid onset of incapacitation, cardiovascular collapse, and confusion and burning sensation. Emergency medical care, protect yourself and patients from further radioactive exposure, treat thermal injuries and blast injuries, manage airway breathing and oxygenation. Iodine tablets can actually help protect against long-term effect of radiation itself. Personal protective equipment is required for chemical, biological, radiological, nuclear exposures. Apply the principles of hazardous material response. Apply the principles of time, distance, and shielding from radiation exposure. Apply the principles of decontamination as for hazardous materials exposure. Uh, we have a special branch of EMS, which is called tactical EMS, tactical response medicine, is not normally taught as part of the most EMT and paramedic curriculums. No one specific operations set up for a TEM exists. I know I've been to one class, which I thought it was kind of a funny thing. It was more of how to work with the police when it comes to the tactical EMS. The patch is pretty cool. It was a black patch that said paramedic on it, but it was black. It wasn't red. Cyber terrorism, the use of computer network tools to shut down critical national infrastructures and medical devices and technology rely on network computer systems, and your protected health information can actually be illegally accessed. Now, a lot, we've had a couple of situations in the past where they actually hold the hospital information hostage if they don't pay. Okay. Okay, and that should be it for this chapter. So what I'm gonna do is on Friday we're gonna start going over some questions. Um, I'm gonna be using EMT prep to develop some questions, and then maybe Monday or Wednesday we'll take the final. What do you guys prefer, Monday or Wednesday? Because if we go on Wednesday, then we can use Monday also to review some review questions. Any comments from the monkey section? Okay, well, I guess I'll give you guys a chance and we'll set the exam for Wednesday. Um, I'm gonna go ahead and call it a night. You guys have a good night, and then we'll see you on Friday and then on Monday so we can review questions.